following is an important step to consider, specifically for increasing the accuracy of points of care urine pregnancy tests. So we want to find something in the choice that is most accurate to specifically the urine pregnancy test. So there might be other aspects we'll see that are important for testing in general, but we want to find something for this specific example. So option A says checking the patient's identification. And that is something that is always important before you do any sort of testing. Checking the patient's identification because you need to make sure it's the right patient for the accurate results. However, in this question, they wrote to specifically consider for the urine pregnancy test. So it's kind of already understood that this is a step you have to do for any sort of testing. We want to get a little more specific from here. So this is something important, but not specifically for this question. So let's keep looking at the other choices. Option B says shaking the test vigorously before use. And remember, anytime we see any of those extreme type words like vigorously, always, never, you want to be very careful. Not to say that it's never the answer, but it's usually not. So let's keep looking. Shaking vigorously would not be effective as the answer to this question. Option C says using morning urine sample for increased accuracy. And this is accurate for this type of a sample, for the urine pregnancy test, because it has increased HCG levels because it's a more concentrated urine sample. So in this type of example, that would be helpful for a more accurate pregnancy test. Unlike if you're doing just your typical urine analysis, usually you don't want to do the first sample because that's been sitting in the patient overnight and it might have a little more bacteria possibly. It might not be the most accurate for that type of a test, but for this test, the urine pregnancy test, it is most accurate. So you just want to know what you're testing for in the sense of what's considered accurate or not. And we will go with option C in this example. But let's also look at option D, which is storing the test in a warm environment prior to use. And that's not necessary. We don't need to store the urine in a warm environment. So after considering all of these steps, we know that option C, using the morning sample, is the best choice for this question.